a sudden it occurred to me, there is a fundamental difference in mentality between the American people and the people in socialized country. It has to do with the importance of the individual versus the importance of the group. And also it has to do with the role of government in the people's life. This is what we have to understand. And we have to understand it very well and hold on to our view that the individual comes first. We have to hold on to that idea for dear life before it is too late and we become like them. I already meet too many people in this country who think just like my sister, and it's almost impossible to argue with them. The government is not a productive entity. Whatever he has, he takes it away from somebody who's producing it. As you heard, the only thing the government has is a gun. The government has the monopoly of force. So the only choice is, what is this gun going to be used for? Is it going to be used to protect you, or is it going to be pointed to your head to dispose of you? In the past, and today in socialized country, the function of the government has been to rule the individual for the benefit of the king, the dictator, or in more modern time, for the benefit of the public good. But who's the public? Well, the public happens to be everybody else except for you. In the United States, the government was, for the first time in history, was placed at the service of the individual to protect individual rights. So that individual like yourself could go out, work, earn your living, fulfill your happiness, and actually feel safe that nobody could kill you, nobody could enslave you, and nobody could take away whatever you honestly produced. These are the principles and the reasons for the unmatched explosion of progress in this country in all fields, including medicine. This is why, despite what some movie wants you to believe, when somebody is very sick in socialized country and really needs something that they cannot get, they do not line up to fly to Cuba. They actually, most of them still do come here. But do not believe for a second that everything we have here is going to stay if we become like Europe or Canada. If we enact the same principles, we're going to have the same consequences. Rights are negative principles. A right to life means that nobody can kill you. It does not mean that somebody should feed you or should give you a dialysis machine. When the government stops protecting your life and it starts choosing who lives or dies, when the government tells you, I have the monopoly on health care, and therefore, I'm sorry, but today is not your lucky day. Today, you are the one who's got to be sacrificed so that the group can live long and thrive. I couldn't resist, I'm sorry. This is how you have rationing, shortage, corruption, black market, and finally, when you cannot pay for services even if you want to, you have death. Ironically, the fact that the government is trying to give you something, a good or a service, as a right, that has the ultimate consequence that is not going to be available for people when they really need it. When the government stops protecting your liberty and it forces you to provide services to people who now are given the rights to your work, that's when you become a slave. The AMA in 1947, believe it or not, warned doctors that Truman's plan would turn them into slaves. There is something a lot worse than the evil profit principle they're so desperately trying to eliminate. You know, the more you work and the more you get paid. Try the more you work and the less you get paid. The last time they tried in Russia, it didn't work. But we're still trying to make it work in the People's Republic of Massachusetts. When the government stops protecting your right to make your choices and to fulfill your happiness, and it takes over every aspect of your life, that's called socialism. The AMA in 1947 warned doctors that according to Vladimir As Dr. Astorino has shown, the history of healthcare in this country has been a constant violation of rights and the right principles. We are going from life, liberty, and the pursuit of happiness towards death, slavery, and socialism. It's easy to decide if the reform is good or bad. Just ask yourself, where is it going to get you? Is it going to get you towards violation or towards protection of individual rights? If it's getting you to move in the direction of violation, and violation is what got us here, it's not going to help. The good news is that the doctors' cooperation is necessary to enable Obama's care. Despite the fact that often they treat us as guilty criminals, just because we work hard and we make a good living taking care of our patients, they count on our integrity to make the system work. They count on us to continue to perform medical miracles despite all the obstacles that they're putting on our way. They count on us to continue to work without adequate compensation, despite denial of payments for needed procedure and needed treatments, despite essential medication not being covered or available any longer. They expect us to continue to take very sick people as our patients, while we are being scrutinized and punished for unavoidable complications by denied payments or worse. The flaw in the system is that we can say, no, we are not going to work as slaves. We are not going to be put in a position where we have to choose between our career and the life of our patients. We are not going to stand back and watch our patients die of acute case of rationing. The most important thing that we have to understand, and which is the deeper answer to my sister's argument, is that socialized medicine is not a noble system which needs government enforcement, because we are not able to actually enable it all by ourselves voluntarily. Socialized medicine does not work because it's incompatible with human life. It is an immoral system. And this is the next topic. Thank you.